everyone. I'm talking about tissue healing today. I had somebody on Instagram ask a really good question. What tissue healing guidelines do you use? Everyone's going to be so different. The injury is going to be different. The location, trauma, non-traumatic. Either way, there is a framework that I use, and I always recommend it to other clinicians. And it's pretty standard across the board. So whether you're talking about shin splints, you're talking about post-surgical, you're talking about plantar fascial pain, Achilles tendonitis, it doesn't matter. It's all the same framework. There's going to be little nuances here and there, but ultimately it's the same framework. So in general, for tissue healing, regardless of the body part, you know if there is trauma in a certain area or there is inflammation and it's new, you're going to have 48 to 72 hours to be able to calm inflammation down. This is going to be controlled with all of your rest, anti-inflammatories, whatever you believe in, whatever your practice is in those early phases. In 2 weeks, now you're going to transition into subacute trauma. Now you're going to have a point where there's the inflammation gone, but there is still pain. There's localized effusion or localized bruising, whatever it is. So in 2 weeks, if we're talking about a new pain, and they now have 10 out of 10 pain, and at 2 weeks later they're still having significant pain and that hasn't reduced, that's a next entry point. They're already going into a 6-week block of pain. So when somebody says, how long is this going to take, you can give them a general guideline. Within 72 hours, that should be at least 10 to 20% better. By 2 weeks, you should be around that 40 to 50% mark. If you don't see that improvement, you're going already to that 6-week mark. If they come at 80 or 90% at 2 weeks, you've already achieved a really big milestone. That 90% is going to be huge. It tells you where they're going to be. So at 6 weeks, what are you doing? What percent are they at? Well, I'm still pretty flared up. If they're at not at 90%, they're now going to bump to that 12-week mark. And all you have is this cascade of events that's happening. Why? Just because of natural organic healing processes that are going to happen inside their body. And this is all going to vary as well with just how motivated they are, how much time and energy they're putting into the recovery. But just know that if you're not hitting certain milestones, if they're not 90 by 12, they're going 90 at 4 to 6 months. So at this point, this person's probably post-surgical or some type of large trauma, sciatic nerve issue, whatever it is. So percentages wise, you want to follow kind of a 90% rule. By 90% means that they've actually achieved that milestone, or they're going to continue. If they're not at 90, they're going to continue on to the next stage. So just food for thought. And then post-surgical, you're talking about 6 months, they're about 80 to 85. 9 months, they're finally hitting 90 to 95. And then a year, they're about 99%. They won't hit that until later. But general guidelines for somebody who has trauma, somebody has musculoskeletal pain, these are the good time points to be able to consider. Is it going to last 2? Is it going to be 6 weeks? So if they can hit 90% by 6 weeks, you know that you can realistically do that. If they're not 90% by 12, you're going on to that 4 to 6 month mark, and just helping guide people and creating kind of bumpers so that they know that if they're not at 90, they're going to be 85% or less, so that you help people understand what the recovery process looks like so that they can actually be motivated to hit certain milestones. So if you say, well, you have to have full range of motion, you have to have time-based as well as criterion-based. You have to have no swelling, your walking has to be normal, and you have to be 90% by 6 weeks in order for you to return to that game. When you put criterion-based and time-based, you're just creating a comprehensive approach to that recovery, and they appreciate that. Most people like to know numbers, percentages, and then what the outcome needs to look like. So if they want to go back to running or playing sports, they need to know that they need to be 90% by 6 weeks. That creates motivation. If you create a deadline, you create the outcome that they need the resources. They need the time, and they need the percentage that they need to be at. If not, if they're excited, they'll make that happen. If you don't provide that, they're just a waiting game and dependent on you, and that's not what we want to create. You don't want to create a dependency model where they just have to come to see you. There's a couple reasons why people do that. One of them could easily be you just not confident with those timelines, and the reason you're not telling them is because that you might not feel that you actually know, and that's where you need to, as a provider, need to be a little bit more confident with these. So those are the general guidelines that I provide. It doesn't matter what the injury is or the surgery. this is the framework that I'm going to use to approach athletes, clients, community, or weekend warriors. It doesn't matter. It's all the same. The tissue healing is going to be the same. So there's your framework. Let me know with any comments below what you use, how you use it any differently, where do you insert different timelines. I'm not really about the semantics of like what you do at every single phase. I'm just trying to create an outline. Tell me what you think and let me know what you do differently.